Age is one of the biggest risk factors for breast cancer. So the New Zealand Breast Cancer Foundation recommends you start regular mammograms once you turn 40.
You just like to pop a gown on?
A regular screening mammogram is the best method we have to detect breast cancer early, because it looks for tiny tumours well before a lump can be felt. These wee granules of couscous are about the size of tumours that a mammogram can pick up, whereas this walnut here, that's about the size a lump actually has to grow until you can feel it yourself.
I didn't have any symptoms at all. So no, I didn't feel unwell at any stage. It was just a routine annual mammogram that picked up the cancer.
If a tumour is found by a screening mammogram, women have a 95% chance of living 5 years or longer. The survival rate for breast cancer is lower if the cancer is found by examination, simply because it's generally more advanced.
The specialist said that, it was really lucky that I'd done what I'd done from the age of 40, and that because it was caught so early that I'd been really careful, and there's probably no more risk, hopefully, for it to come back.
Here we go.
A mammogram is a safe, low-dose X-ray of the breast.
Okay, Eve, would you like to hold your breath again?
4 pictures are usually taken, 2 from the top and 2 from the side.
I've never found mammograms a particular problem. I know some women do. I know that some women find it quite painful. I mean, it's uncomfortable, but it's certainly not it's not a procedure which I find, put it this way, I've had so many of them, it's kind of like, it's a mammogram. Yeah, we'll do that. We get it. It takes very little time.
She's right, it's nothing to write home about and nothing that should put you off.
Basically, we're comparing.
Once the X-rays are finished, your mammogram is closely checked by a radiologist who specialises in reading X-rays.
Hopefully we'll see you again in 2 years' time.
Your results will then be sent to you, and with your approval, your doctor, within 2 weeks of your mammogram.
Not a big issue. It's good. I feel comfortable. For me, I feel it's so important because I want to grow old to see my children and get married and have children.
If something shows up on the mammogram that needs checking, you'll be asked to return for further assessment.
Okay, hold your breath, please.
Remember though, most women who are recalled will not have breast cancer. A mammogram is not going to stop you getting breast cancer, but what it does do is it cuts the risk of dying from it by around a third. The New Zealand Breast Cancer Foundation recommends that women have a mammogram every year from 40 to 49, and then every 2 years after turning 50. Between the ages of 40 to 44, you'll need to pay for an annual mammogram. However, if your doctor is concerned about your breast health, you may be referred for further assessment at no cost.
At the age of 40, I decided to have mammograms. And so I'm really glad that I didn't wait until I was 45, because it could have been a lot worse.
Once you turn 45, mammograms are provided free to well women with no symptoms until the age of 69. To check your eligibility to enrol, call 0800 270 200. Once you turn 70, keep having those mammograms if you're in good health, as your breast cancer risk is higher now than in your 50s.
Where's your brother?
Younger women get breast cancer too.
I was 25. I had just been away on holiday with my now husband and found a lump. Is Georgia going to get your cars?
For women under 40, a mammogram is not usually recommended, as younger breasts tend to be denser. This can make it difficult to see small changes on a mammogram image. An ultrasound scan or MRI may be recommended instead to investigate breast changes. While the risk for younger women is lower, their breast cancer is sometimes more aggressive, so it's important to get unusual breast changes checked out.
I'm just going to lean you in.
Remember, early detection is your best defence against breast cancer. The earlier it's found, the easier it is to treat. So start having mammograms at 40. And if you develop any breast changes, show your doctor straight away. Don't wait until your next mammogram. it could be too late. For more advice, call the New Zealand Breast Cancer Foundation on 0800 BC Nurse or talk to your doctor.